This is All India Radio. We now bring you a special program on COVID-19. Good morning, I'm Tanvi Taneja, and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 this morning. India records lowest daily COVID-19 growth rate of 6% since March 15th. Interministerial central teams to take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. Rail coach factory Kapurthala resumes production after a 28-day lockdown. Chemicals and petrochemicals industry becomes top exporting sector for the first time. And World Health Organization says there is no evidence that recovered patients are immune to COVID-19 infection. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio at 11 this morning. It will be the 64th episode of the monthly radio program. It will be broadcast on the entire network of All India Radio and Doordarshan and also on AIR News website www.newsonair.com and News on AIR mobile app. It will also be streamed live on the YouTube channels of All India Radio, DD News, Prime Minister's Office and Information and Broadcasting Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will also be repeated at 8 in the evening. India recorded a 6% growth in coronavirus cases in 24 hours from Friday 8 a.m. to Saturday 8 a.m., the lowest daily growth rate recorded since March 15th. The average doubling rate of COVID-19 cases in the country is 9.1 days as of now. The government has enforced a nationwide lockdown for containing the disease. It said the country recorded a 6% growth in new cases from Friday 8 a.m. to Saturday 8 a.m., the slowest uptick in daily new cases since crossing 100 cases.
Group of Ministers, GOM, reviewed the current status and actions for management of COVID-19 at a meeting in New Delhi yesterday. A detailed presentation on the status of COVID-19 in the country, along with the response and its management, were made. The GOM had a detailed deliberation on the measures taken by the centre and various states and union territories for the prevention, containment and management of COVID-19. The GOM was informed that all districts have been asked to follow and further strengthen their contingency plans to combat COVID-19. It was briefed on the state-wise details of dedicated COVID-19 hospitals, along with the adequacy of isolation beds, PPEs, N95 masks, drugs, ventilators and oxygen cylinders. The GOM was informed the domestic manufacturers, which have been identified earlier, have already started the production of PPEs and masks, and at present the stock is available. It was informed that more than 1 lakh PPEs and N95 masks are being manufactured every day in the country. There are at present 104 domestic manufacturers of PPEs and 3 making N95 masks in the country. In addition, production of ventilators has also started and orders have been placed for more than 59,000 units through 9 manufacturers. A control room has been set up in Lok Sabha Secretariat with immediate effect to facilitate a quick interface between MPs, MLAs and public for emergency assistance in the fight against COVID-19. On the call by Lok Sabha Speaker Om Birla during a video conference with presiding officers of state legislatures last Tuesday, several state legislatures have established control rooms for immediate assistance. Rajasthan, Haryana, Odisha, Delhi, Uttarakhand and Madhya Pradesh are the first states wherein control rooms have been set up in their respective legislature secretariats. The control rooms have already started functioning to help real-time exchange of information between state legislatures and Parliament. This will allow MPs, MLAs and MLCs to discharge their duties in a more effective manner in fight against the challenge posed by COVID-19.
New interministerial central teams constituted by Ministry of Home Affairs took stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat yesterday. In Telangana, the team took stock of the pandemic situation in Hyderabad. The central team called on the State Chief Secretary Somesh Kumar and visited the Telangana Institute of Medical Sciences and Research at Gachibowli. The team inquired various aspects like observing lockdown, following pandemic protocol, treatment of COVID-19 patients, among others. In Tamil Nadu, the central team reviewed the arrangements in Chennai to contain the disease. In Gujarat, two central teams reviewed COVID-19 situation in Ahmedabad and Surat yesterday. Our correspondent reports that the team held meetings with the district collectors and police officials in both the cities and took stock of the steps taken by police and administration in view of COVID-19. Indian Railways Production Unit, Rail Coach Factory, RCF, at Kapurthala has reopened its production process after 28 days of nationwide lockdown. In a relentless battle against COVID-19, the factory has been opened adhering all safety precautions and guidelines, and despite limited availability of resources for production, it has produced 2 parcels coaches, 1 LHB high-capacity parcel van and 1 luggage-cum-generator car in the last 2 days. A total of 3,744 employees have been permitted to join work who are residing inside the RCF premises township. All employees who join duty after lockdown have been issued a safety kit having masks, sanitizer bottle and soap. They are being regularly counselled by their supervisors and officers for safety guidelines to be followed at workplace. Lala Lajpat Rai Rail Hospital, situated in the RCF campus, has provided separate counters and OPD cell for the patients having any symptoms of COVID infection. 24-bed quarantine facility in the RCF campus and 8-bed isolation ward in LLR Hospital is ready to handle any case related to COVID. As per the guidelines of Ministry of Home Affairs and Advisory of State Governments, other production units of Indian Railways will resume production as and when advised.
India's chemical exports rose by 7% to 2.68 lakh crore rupees during April-January period of the last fiscal and became the top exporting sector in the country for the first time. Union Minister of Chemicals and Fertilizers, D.V. Sadananda Gowda, congratulated the chemicals and petrochemicals industry on becoming the top exporting sector of the country for the first time. Mr. Gowda informed that during April 2019, January 2020, the export of chemicals grew by 7.43% over the corresponding period of the previous fiscal. Total export of chemicals during this period reached 2.6 lakh crore rupees. This constitutes 14.35% of the total exports. The minister assured full support to the industry towards making India a leading global hub for manufacturing of chemicals and petrochemicals. He said continuous efforts made by the Department of Chemicals and Petrochemicals have enabled the industry to become the topmost exporting segment for the first time. Central government is making concerted effort to facilitate farmers in direct marketing and assure better returns for their harvested produce during lockdown period. The states have been requested to promote the concept of direct marketing to facilitate farmers, producer organization FPOs and cooperatives in selling their produce to bulk buyers and big retailers. Agriculture Ministry has also issued an advisory to the states to promote direct marketing without insisting for licensing procedures and facilitate the farmers in timely marketing of farm produce. More from our correspondent.
The Agriculture Ministry has introduced 2 modules under National Agriculture Market (ENAM) with a view to decongest wholesale markets and to boost the supply chain. Under FPO module, farmer-producer organizations can directly trade with ENAM portal by uploading produce details from collection centers with picture and quality parameter. By doing so, they can avail the bidding facility without going to the mandis. While under warehouse-based trading module, farmers can sell their produce from Warehousing Development and Regulatory Authority registered warehouses. Various states including Karnataka, Uttar Pradesh, Rajasthan, Gujarat and Uttarakhand have allowed direct marketing without requirement of any license. As per the report received from the states, the direct marketing has facilitated the farmers' groups, cooperatives and all the stakeholders in timely marketing of farm produce. The ENAM is a pan-India electronic trade portal linking agriculture produce market committees across the states. Anand Kumar, AIR News, Delhi.
This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 this morning. India records lowest daily COVID-19 growth rate of 6% since March 15. Interministerial central teams take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. Rail coach factory Kapurthala resumes production after a 28-day lockdown. Chemicals and petrochemicals industry becomes top exporting sector for the first time. World Health Organization says there is no evidence that recovered patients are immune to COVID-19 infection. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
All the popular programs of Doordarshan now on DD Retro. Mahabharat, Shaktiman, Sankat Mochan Hanuman, Bunyad, Dekh Bhai Dekh, Chanakya, Upanishad Ganga. To watch all the popular programs of Doordarshan now on DD Retro, contact your local cable operator.
लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें: डीडी 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन डीटीएच 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
Welcome back. You're listening to a special news program on COVID-19. The government has allowed 29 insurance and 9 securities entities to use Aadhaar authentication services under the Prevention of Money Laundering Act. The Department of Revenue has given permission to them to undertake Aadhaar authentication services of UIDAI, subject to their complying with standard security and privacy measures as per the Aadhaar Act and to the satisfaction of their respective regulatory authorities. Finance Secretary Dr. Ajay Bhushan Pandey said the decision will help these entities to perform in real time, do eKYC, and will also reduce their cost of transaction. He said this will also be beneficial to the customers or the investors, especially the small and retail investors, as they need not submit physical papers or documents for KYC. Entities that have been allowed to use Aadhaar authentication services include Bajaj Allianz Life Insurance, Bharti AXA Life Insurance, HDFC Life Insurance, SBI Life Insurance, Reliance Nippon Life Insurance, Religare Health Insurance, Aditya Birla Sun Life Insurance, Bombay Stock Exchange Limited, National Securities Depository Limited, NSDL Database Management Limited, and NSE Data and Analytics Limited. The Revenue Department, however, said that it is a voluntary measure and use of Aadhaar authentication service is voluntary. It said if some investor gives PAN, then they need not go for Aadhaar authentication. Border Roads Organisation BRO has opened the Rohtang Pass more than 3 weeks in advance after clearing snow. It is the arterial road connecting Lahaul and Spiti district of Himachal Pradesh from the rest of the country. Last year, it was opened on 18th of May. Himachal Pradesh government had approached BRO to expedite the snow clearance to facilitate return of farmers for starting cultivation and movement of essential supplies and to bring relief materials to Lahaul Valley in wake of COVID-19. BRO inducted high-tech machinery from both Manali and Koksar side. First convoy of vehicles carrying essential supplies and approximately 150 farmers moved to Lahaul Valley yesterday, guided by BRO, thus officially opening the Rohtang Pass this year. It will facilitate the centre and state governments to bring the much-needed relief material and medical supplies for the local population.
Maharashtra has reported 811 new COVID-19 cases, taking the total number of the affected people in the state to 7,628. State Health Department said that 22 people succumbed to the COVID-19 disease in the state, taking the death toll to 323 so far. With 119 patients discharged after recovery, their number rose to 1,076. A central team visited Thane district yesterday to monitor efforts to combat the novel coronavirus outbreak. The central team, led by Additional Secretary Secretary in Food Processing Industries Ministry, Manoj Joshi, met civic chiefs, police officials and visited hospitals involved in treating COVID-19 patients. Even as the COVID-19 is wreaking havoc in Mumbai, Pune and Malegaon, there are still a number of districts in Maharashtra where no case of novel coronavirus has been reported. The Gadchiroli district is one of them, where no COVID-19 case is being reported till date. Let's take a glimpse into one such village of this district, which is taking due care to safeguard itself.
Gadchiroli district in Maharashtra's Vidarbha region may have earned a dubious distinction for being Naxal infested, but in today's date, the district has earned the honor of being COVID-19 free. That is probably because the villagers of Belgaon Ghat are taking necessary precautions to safeguard themselves from the novel coronavirus. Belgaon Ghat comes under Kochi Taluka and is part of a group Gram Panchayat. The overall population of this tribal village is a meager 1200. However, efforts taken by the villagers are laudable. From the day lockdown was announced, the borders of this particular village were sealed besides all other requisite measures. The two other villages which are part of Belgaon Ghat's group Gram Panchayat too have decided to regularly disinfect their public places. Not just that, face masks too were distributed among the villagers by the Gram Panchayat. If one visits a ration shop, he or she is first asked to wash their hands properly with a soap, and only then the person is allowed to stand in the queue, that too by maintaining social distancing. The villagers have gone back to olden means of communications as well. Beating of drums is more frequently heard these days to alert villagers to keep a watch so that outsiders do not gain access into the village. In case someone has to enter the village, the police patrol has to be intimated and then the visitor is taken for a health checkup. With Jayant Nimgade and Kunal Shinde, this is Nisha Rani for AIR News, Mumbai.
Delhi government has extended its list of cluster containment zones to 95 to contain the spread of COVID-19. Area around street number 3 and 9 in Shalimar village and block 10 in Yadav Villa were the two new additions to the list of containment zones in the national capital. Orders have been given to seal the demarcated zones under the Operation Shield of the Delhi government. A total of 111 new confirmed cases of novel coronavirus has been reported in Delhi during the last 24 hours, taking the total number of cases to 2,625. Delhi government has confirmed that 869 patients have been cured and discharged so far, and 54 deaths have been reported in the national capital. A total 35,519 tests have been conducted so far.
The Himachal Pradesh government has decided to relax the curfew in the state for the convenience of senior citizens and the common people. Additional relaxation hours in curfew will be given in the morning as well.
Keeping in view the convenience and morning excursions of senior citizens and common people, the state government has decided to relax the curfew from 5:30 a.m. to 7 a.m. daily from today onwards in the state. Whereas in capital Shimla, the relaxation hours in morning would be 6 a.m. to 8 a.m. On the other hand, the normal curfew has been relaxed for 4 hours instead of 3 hours from tomorrow. Meanwhile, Chief Minister Jairam Thakur has said students returning back from other states will be subjected to medical checkup and will be kept in home quarantine. Chief Minister has also directed the officers to facilitate the stranded people of other states in Himachal Pradesh to go to their respective states. Sanjeev Sundaryal, AIR News, Shimla.
In Gujarat, all shops except those located in COVID-19 containment zones, malls and shopping complexes will be allowed to open from today. The decision was taken as per the circular by Union Ministry of Home. The total number of COVID-19 cases in the state has gone up to 3,071 with 256 new cases reported yesterday. Out of the total cases, 2,003 cases were reported from Ahmedabad alone. 2 separate interministerial central teams are on a visit to the state. Yesterday, the teams held talks with the senior officials and took stock of the COVID-19 situation in Surat and Ahmedabad. Today, the teams are likely to visit hotspot areas of both the cities to review the ground-level situation. More from our correspondent.
Along with the shops, the state government has also allowed IT and IT-based services located outside the containment zone to start their operations in 50% staff strength. However, barber shops, shops selling pan masala, tobacco, tea stalls and restaurants have not been given permission to function. Taxi and auto rickshaw services will also remain suspended in the state. Mr. Kumar added that all the shopkeepers will have to wear masks, follow social distancing norms and required to keep only half of the staff. The local administration in in Ahmedabad, Surat, Rajkot, Vadodara and Bhavnagar declared containment zone where only essential services will remain open. Aparna Khut, AR News, Ahmedabad.
In Tamil Nadu, the Interministerial Central Team to assess the ground situation of COVID-19 reviewed the arrangements in the city yesterday with senior state authorities and corporation officials. 94 patients were discharged yesterday from hospitals, while 66 new cases have been confirmed in the state. One person died of the disease, taking the toll to 23. More from our correspondent.
To contain the onslaught of the SARS-CoV-2 virus that causes the COVID-19 disease, several local administrations in Tamil Nadu have announced total lockdown from today for a limited number of days. Chennai Corporation and its adjoining areas in the 3 districts of Chengalpattu, Kanchipuram and Tiruvallur have come under full-scale curfew for 4 days from this morning. Coimbatore and Madurai also follow the 4 days full curfew from today, while Tirupur and Salem have been locked down completely from this morning till Tuesday night. Kadalur and Tiruvarur districts go for a single day full-scale lockdown today. Meanwhile, the statewide general lockdown continues till May 3rd. Jay Singh, AR News, Chennai.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and myth-busters. There is a misconception that people should also make distance from those patients who have recovered from COVID-19 infection. President of Public Health Foundation of India, Dr. K. Srinath Reddy, said, "There's nothing to worry from these persons and family members can meet the person who has recovered from the disease." Dr. Reddy, however, advised for maintaining social distancing from outsiders. He said people should not trouble those who have returned home after being cured of the disease.
Social distancing is a very effective measure for preventing the transmission of the virus from an infected person to a non-infected person. So we must maintain a distance of at least 2 meters between ourselves and another person so that we can prevent this virus from traveling between 2 people. We must also ensure that this happens both outside in the market but also in offices where we have to work together with other people.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS, Dr. Randeep Guleria, advised the people to aggressively follow social distancing and hand hygiene norms to check the spread of COVID-19 infection.
Currently, we have to be aggressive in social distancing, hand washing and quarantine, and this is more and more important in the hotspots. And I would also say that we should try and support people because this is a time of hardship as far as people of the low socio-economic status are concerned, and also be able to support and encourage our doctors, the healthcare professionals who are fighting at the front line against this pandemic.
Talking to AIR News, Dr. Naresh Gupta of LNJP Hospital, Delhi, said that in most of the cases, the COVID-19 infections are self-limiting and very few patients required admission in hospitals.
कॉमन कोल्ड और कोरोना वायरस इन्फेक्शन दोनों की दोनों आम तौर से अपने आप ही सेटल कर जाते हैं। 80% में तो ऐसी भी तकलीफ नहीं करते हैं या इतनी हल्की करते हैं कि लोग घर पे ही ठीक हो जाते हैं। 10-15% में उनको अस्पताल जाके कुछ दवाई दी जाती है और वो सेटल हो जाते हैं। 5% या उससे कम वाले हैं जो कि दाखिल होना पड़ता है। तो फर्क आप नहीं कर पाएंगे, सेटल आप हो जाएंगे, लेकिन इसका बचाव अपने लिए जिससे कि हॉस्पिटलाइजेशन की नौबत ना आए और उससे ज्यादा दूसरों को ना लगे, क्योंकि ये जरूरी नहीं कि किसी इंसान को अगर हल्के रूप में कोरोना वायरस हुआ है तो जिससे उस इंसान को लगेगा वो भी हल्का ही होगा, वो इतना तीखा हो सकता है कि वो जानलेवा भी हो सकता है, तो वो जानना जरूरी है।
Farmers across India are benefiting from the Kisan Samman Nidhi Yojana. In Pauri, Uttarakhand's 58,000 registered farmers have benefited from it. Vijendra Singh Rawat shared his experience with All India Radio News.
हमें बहुत सहायता प्रदान हो रही है। जैसे कि यांत्रिक की हम बात करें तो कृषि विभाग ने हमें कई कृषि यंत्र दिए हैं जिससे कि हमारी मैन पावर में बहुत कमी आई है। अन्यथा हमारे पास यहाँ पे पलायन के कारण मैन पावर तो है ही नहीं और हमें खेती करने में बहुत समस्याएं होती थी, लेकिन कृषि विभाग के हमारे सहयोग के कारण ही हमारे पास जो ये कृषि यंत्र है, कृषि फार्म मशीनरी बैंक कृषि विभाग ने जो हमें दिया है, उससे हमें खेती करने में बहुत सहायता मिली है। और इसके साथ साथ हम ये चाहते हैं कि सरकार ने जो ये खाद और बीज पर हमको सब्सिडी प्रदान करती है वो भी एक प्रशंसनीय कार्य है।
In Bihar, people have pledged to follow the social distancing norms. Here is a report.
सोशल डिस्टेंसिंग, सामाजिक दूरी, जिसकी दूरी एक दूसरे व्यक्ति से कम 1 मीटर होगी, का पालन करूंगा। मैं शौच के बाद या अपने मुंह आंख, नाक और कान छूने से पहले तथा नियमित रूप से साबुन और पानी से कम 20 सेकेंड से अधिक समय तक अपने हाथों को धोऊंगा।
Veteran actor Ajay Devgan has called upon the people to download Arogya Setu app to ward off coronavirus. He described the app as a new bodyguard of the people.
गुड मॉर्निंग सर। आप कौन? सर मैं आपका नया बॉडीगार्ड सेतु। सेतु? लेकिन मेरे पास तो ऑलरेडी बॉडीगार्ड्स हैं। सर मैं एक अलग टाइप का बॉडीगार्ड हूँ। कोरोना वायरस से आपकी बॉडी को सिर्फ सेतु ही गार्ड कर सकता है। कोरोना वायरस से? वो कैसे? सर वो ऐसे कि मैं आपको पहले ही बता देता हूँ कि आपको कोरोना वायरस से कोई खतरा तो नहीं। अच्छा, आपके आसपास कोई कोरोना पॉजिटिव हो तो मैं आपको पहले ही अलर्ट कर देता हूँ। कंटिन्यू। सर और तो और मैं आपको ये भी बताता हूँ कि आपसे आपके परिवार वालों को कोई खतरा तो नहीं। मुझसे मेरी फैमिली को क्या खतरा होगा यार। सर जानबूझ के थोड़ी। अगर अनजाने में आप किसी कोरोना पॉजिटिव इंसान के टच में आ गए तो मैं आपको फौरन अलर्ट कर दूंगा ताकि कहीं आप इस बीमारी को अपनी फैमिली तक न पहुंचा दें। और ये सब सिर्फ मेरे लिए, सिर्फ आपके लिए ही नहीं सर। भारत सरकार ने मुझे 130 करोड़ हिंदुस्तानियों की रक्षा के लिए हर एक का पर्सनल बॉडीगार्ड बनाया है। अरे कहां गया? टेंशन मत लीजिए सर, हर वक्त आपके फोन में एक ऐप बनकर रहूंगा। आप भी आज और अभी आरोग्य सेतु ऐप डाउनलोड करें। सेतु मेरा बॉडीगार्ड है और आपका भी।
World Health Organization (WHO) has said that there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. WHO said no study has evaluated whether the presence of antibodies to SARS-CoV-2 confers immunity to subsequent infection by this virus in humans. WHO said that there is still a lack of sufficient evidence for the effectiveness of antibody-mediated immunity to guarantee the accuracy of an immunity passport or risk-free certificate. According to the UN agency, laboratory tests that detect antibodies to SARS-CoV-2 in people, including rapid immunodiagnostic tests, need further validation to determine their accuracy and reliability. The new coronavirus has claimed more than 2 lakh lives globally since its outbreak in December 2019 in China. More than 28,64,000 cases were registered in 193 countries and territories. Of these cases, over 7,72,000 are now considered recovered. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. A.K. Varshni, Professor, Department of Medicine, RML Hospital, will participate in the discussion. Listeners can ask questions related to stress, anxiety and depression due to COVID-19 pandemic on toll-free telephone number 1800115767. I repeat, 1800115767. You can also ask questions on the telephone number 011-2331 4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards.
And now an overview of today's newspapers covering COVID-19 stories. The government allowing all shops to open in residential areas with 50% staff gets highlighted by most dailies. Shops can open in safe zones, headlines a Sunday Pioneer. But government order excludes malls, urban marketing complexes, liquor shops, salons, adds the Daily. After Delhi, 5 more states favour curbs in hotspots beyond May 3rd, headlines a Sunday Times. The states are Maharashtra, Madhya Pradesh, West Bengal, Punjab and Odisha. UP, MP, Haryana pay way. Migrants board buses home, informs the Sunday Express. Punjab to help students stuck abroad, DCs to give info, writes a Tribune. The Statesman reports IMCT shoots off 2 more letters to Bengal government, citing non-cooperation, no fresh deaths reported in state. The Tribune writes Chinese rapid test kits put on hold, ICMR to give final report. And finally, in worrying news for India, the virus causing COVID-19 can cling to air pollution particles. Tests conducted in Italy have found. The Hindustan Times reports that virus can survive on a particulate matter.
And now, before we end the special news program on COVID-19, here are the headlines once again. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 this morning. India records lowest daily COVID-19 growth rate of 6% since March 15. Interministerial central teams to take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. Rail coach factory Kapurthala resumes production after a 28-day lockdown. Chemicals and petrochemicals industry becomes top exporting sector for the first time. And World Health Organization says there is no evidence that recovered patients are immune to COVID-19 infection. And with that, we end the special news program on COVID-19.